Well, hello everyone. This is Dr. Greg Anderson, your chiropractor and nutritionist, and I want to talk to you a little bit today about chiropractic and immunity. We've had a lot of questions during this COVID-19 pandemic from our patients about how does chiropractic actually augment or boost the function of the immune system? How does being under regular chiropractic care increase one's immune competence or immunocompetence? So there has always been two approaches to germs, bugs, microbes, and the one we're all familiar with is kill the bugs. And after years of using this approach, and this is mostly the antibiotic approach, we now have many microbes that can no longer be killed by antibiotics because they've actually become resistant through mutation to the antibiotic. And so we have some serious diseases out there in which we don't really have any antibiotic help anymore because antibiotics have been used too often, too frequently, and for the wrong types of cases. The second part of dealing with germs, microbes, bugs is to actually strengthen the person, strengthen the host. And a healthy, functioning immune system requires a number of things. You have to have proper sleep, proper nutrition. You need to have lower stress. And we've talked about this before. High stress means high cortisol. High cortisol dampens your immune system. And foremost, you have to have a nervous system that can communicate with all the body parts. So B.J. Palmer, the developer of chiropractic, once said, poetically, have you more faith in a spoonful of medicine than in the power that animated the living world? In other words, do you have more faith in a bunch of pills or a spoonful of medicine than the actual power or force that intelligently runs your body? Well, that's a good question. Do you? So let's look at some of the studies that show the benefits of strengthening the host. So one of the things we can do is we can go back like a forensic pathologist and look at one of the great pandemics of this world, and that was the Spanish flu pandemic. And by the way, it killed 50 million people. So this coronavirus thing that we're in is absolutely a drop in the bucket. I don't want to say something that would irritate people because they have family members who are sick or have died from this, but this really isn't on the same level as the pandemic of 1918 with the Spanish flu. But here's some statistics from Iowa. And what they did in these studies is they looked at the number of people under medical care versus the number of people under chiropractic care for the Spanish flu and the number of deaths in each population. And you can see here in the state of Iowa, these statistics actually came from the city of Davenport, which was where Palmer School of Chiropractic was, that out of 5,000 cases of flu, 274 medical patients died. With 1,600 cases of flu, only one patient died of the Spanish flu. So there's quite a difference there. We didn't treat as many people, but we had way less deaths. So if we look at New York City, they did this in a different way. They looked at out of each 10,000 people, how many deaths were there in people who were treating patients with Spanish flu. So in the allopathic or medical context, 950 people out of every 10,000 that had the flu died in New York City. And if we look at the chiropractor patients, they had only 25 deaths out of every 10,000 people or 10,000 cases that they took on. So the death rate was quite different and quite superior to what was being done allopathically or medically at that time. If we look at Oklahoma, we see a similar situation. The medical profession was seeing the majority of the worst Spanish flu cases. And in this particular case, there were 203 cases that medical doctors had already cared for, and they basically had given up. They pronounced them lost or beyond hope. They were all going to die. So chiropractors took over those 233 cases. They only had 25 deaths out of that 233. Um, Whereas the medical profession saw that as 100% of those people would be gone because they didn't have the immunity to fight this off. So we learned quite a bit from this Spanish flu epidemic. In 1975, this is a great study. It was a study that was performed by the chief of cancer prevention at New York's Preventive Medicine Institute. His name was Ronald Perot. And in his 3 year study, he found that 107 chiropractic patients had 200% greater immune competence than those who had not received chiropractic care. So those people that hadn't received chiropractic care were healthy, had no diagnoses, were not taking medications. The only difference was they weren't under regular chiropractic care. And then they compared that chiropractic group to the people who had cancer and other serious diseases. And they found a 400% greater immune competence among that group. And you can see on the graph here that compared to the normal non-chiropractic group, we were 200% greater sense of immunity when they tested us. So what they did was, in the study, they took cells that were responsible for engulfing and destroying viruses, bacteria, parasites, cancer cells, and they found that those cells were anywhere from 2 to 4 times more active in the people who had regular chiropractic care. And Dr. Perot mentioned in his study, he said, I've never seen a group other than this chiropractic group that experienced a 200% increase over normal patients. That's why this study is so dramatically important. And then he finished with this comment: chiropractic may optimize whatever genetic abilities you have in relation to your immune competence. I have another way to word that. If you have a healthy nervous system that's running the whole body, then your immune system, as well as every other system in your body, is going to work better. The Brennan study in 1991. So this was a study that was published in the Journal of Manipulative and Physical Therapy. It's a study that connects the nervous system and the immune system. This was very early. Medicine had just at that particular time in the early 90s discovered something that chiropractors had been saying since 1895, that the nervous system ran the immune system. And then they finally discovered that in the 1990s, that the immune system was being guided, directed by the nervous system. And specifically in this Brennan study, they demonstrated that the phagocytic respiratory burst of polymorphonuclear neutrophils and monocytes were enhanced in adults that had been adjusted by chiropractors. In ordinary language, these phagocytic polymorphonuclear neutrophils we could look at as Pac-Man. And they run through your tissues, they run through your blood cells, and they eat and destroy all the bad cells. And so what this study was saying is that people that had an adjustment had enhanced neutrophil actions, that their immune system was actually working better than those that weren't adjusted. This is a pretty important study. The Emory University study, 1994. So what researchers did in this study is they took a group of HIV positive patients and adjusted them over a 6-year period. So just to kind of remind you about HIV, what we learned very early on with HIV was the way that virus worked is it attached itself to a CD4 cell. A CD4 cell is a type of T lymphocyte that fights off viruses. Well, in the case of HIV, CD4 cells are the main cell that goes after the HIV virus. And so what happened is this virus was attaching itself to the surface of these CD4 cells, injecting their material and turning a CD4 cell that was supposed to fight an infection basically into a virus machine for creating more and more viruses. And so what happened was, after adjusting these patients, measurements were taken at individual labs where people were under medical supervision for their HIV. The control group, those that were not adjusted, did not demonstrate an increase in their immune function. But those who were adjusted had a 48% increase in the number of CD4 cells. That's a huge, dramatic increase. And that group that wasn't adjusted, their CD4 counts actually went down about 8% over the same period of time, which is normal for an HIV patient as their immune system continually begins to tank. And so, what this tells us is even in a viral disease like HIV, once the immune system can be optimized, it has the ability to begin to take over again and ferret out the viral infections and take care of the problem. So this study, and I'll try and pronounce it just for your humor, but I would call it the Teodorzik Ingenin study of 2008. And what they studied was a cytokine. So cytokines are made by primarily white blood cells, and what they do, they're signaling chemicals that actually signal for other white blood cells to respond whenever there's an immune threat, like a wound or an injury or something of that nature. And what they studied primarily was interleukin 2 or IL-2. And so what they did was they had three different arms in this study. They had a control group, and that's a group that received chiropractic adjustments and they got a sound like that cracking sound you hear in your spine. Then they got another group that had spinal care, but they had none of this cracking going on. And the third group was a control group that basically had no adjustments whatsoever. And they were looking at for several things. They wanted to see if there was a difference between the patients in the enhancement of their immune system if they had an adjustment without noises versus adjustments with cracking noises. And what they found out was it didn't make a difference whether you had a crack sound or you didn't have one, that it was the same. Both adjustments increased the production of interleukin 2 in the people that received adjustments. And they compared that 20 minutes after the adjustment, but then 2 hours later, they still found that increase of interleukin 2. So basically, the immune system had responded to the nervous system in a positive way and basically was ready to fight off a coming attack. So this is a really good study and shows us from a biochemical basis how chiropractic and your nervous system is involved with augmenting or empowering your immune system. So to remind you what Ronald Perot said in his study, he said, "I've never seen a group other than the chiropractic group experience a 200% increase in the function of their immune system over normal patients." And he said, chiropractic may optimize whatever genetic abilities you have in relation to your immune competence. But before I leave, I want to just tell you that even children can benefit from chiropractic. Their immune system will function better. In a study that was published in the Chiropractic Research Journal, the wellness of 200 children under chiropractic care was compared to 200 children that were under conventional medical care. And the kids in the chiropractic group that were getting regular adjustments had fewer ear infections, fewer allergies, fewer cases of tonsillitis, and less asthma. The health of the children under chiropractic care was demonstrably superior to the children who had not received it. Some other things about that care, when they surveyed these families, they found out that only 10% of the kids that were under regular chiropractic care had ever had to take any medication. They had had fewer ear infections, fewer allergies, fewer asthma, fewer tonsillitis. The researchers in this study said, "This study has shown that children raised under chiropractic care are less prone to infectious processes and that their immune systems are better able to cope." Amazing study. So here it is. I laid the foundation. Each time that we clear your nervous system of any interference and we open up those nerve channels, all systems of your body work better, including your immune system. Thank you for taking the time to listen to this, and we'll join you shortly with another video. Thank you.